Hello, and welcome to Anaphylaxis UK's Let's Talk About Allergies podcast, where we provide expert answers to common questions about allergies and anaphylaxis. Our goal is to offer valuable insights on how we can all work together to make life easier and safer for those living with allergies. Today's episode is the first of our Bee and Wasp Venom campaign series. This campaign aims to spread awareness about venom allergies and provide essential information on handling serious reactions to bee or wasp stings. In today's episode, we revisit last year's discussion between our CEO Simon Williams and expert Dr. Andrew Whyte on the importance of allergy testing, venom immunotherapy, and emergency response.
So we're going to talk about venom allergies. And to me, when somebody talks to me about a venom, I immediately think about snakes. But we're not talking necessarily about snakes, are we?
Well, we could be. So snakes do have venom. The important difference, really, rather than the word venom, is stings versus bites. So bites are at the front end with the jaws, and that's what snakes obviously do. Horseflies bite as well with their jaws, and people can have anaphylaxis to both of those types of venom. Stings are with the tail, and that's what bees and wasps do, but they also have venom in there. So scientifically speaking, a venom is something that causes a reaction when it's injected, and a toxin is something that is ingested and causes reactions from inside. So rather than the insect as such, it's the bite versus sting and venom versus toxin. Really, that's the big difference.
And we're talking mostly today about bees and wasps. Mm-hmm. And of course, hopefully, I mean, it's, I don't know when people have been watching this, but if they're watching it now in May, it's certainly not May weather. I don't know what bees and wasps think of the weather and whether they come out of this time of year that they normally might come out, but it's really, would you say it's more of a seasonal issue for people?
Yeah, so bees and wasps tend not to be an issue over winter. They can be, particularly in the warmer parts of the country, but broadly speaking, they emerge in spring and they go through summer to April to August and autumn, September, and then they disappear again. So they are a problem, but by and large, it's a spring, summer, early autumn sort of problem.
If somebody got then stung by a bee or a wasp, I mean, first of all, is there a difference? Do people react differently to getting stung by a bee or stung by a wasp? Both are pretty nasty.
Yeah, so they're different insects, different parts. They're both part of a group called Hymenoptera, and within that there are various groups of wasps and bees, different types of each of them. Bees are, generally speaking, the broadest classification is honeybees, which do cause stings, and they're the main problems, and solitary bees, which tend to live in isolation. They have stings, but they're very tiny and they don't cause problems with humans, and bumblebees. Obviously, which are generally fairly benign. They don't sting unless they're provoked quite a bit. Wasps are a bit more diverse. There are the common wasps, which are Vespula and Dolichovespula are the two groups of those. And there are the larger ones like hornets, which are a group called Vespa, which, again, exist in the UK. It's usually the common wasps that tend to be more of a problem. And in Europe and occasionally in the UK, there are other ones as well. And when they sting, they cause reactions in exactly the same way. They have different types of venom, different constituents. So if you're allergic to one, it doesn't mean you're allergic to another. And really, bees and wasps are a big problem. So they're the ones that we can treat with the licensed products that are available.
And how would you know that you have an allergy to the sting? Are there any kind of symptoms beforehand or any signs that might suggest that you are particularly at risk?
So broadly speaking, no. You won't know unless you're stung, and that would be the diagnostic test as it was. We can't obviously do that medically, but if you're stung in the field and you don't have a reaction, then you're not allergic to them. The risk factors which would let you know that are things like being a beekeeper will put your risk up. It's still not by no means guaranteed that you react, but things like beekeeping obviously put you at higher risk. underlying medical conditions like mast cell disorders. Mast cells are the cells that release the histamine and cause the reactions. If you have too many of them, it stands to reason you're going to have more severe reactions. Adults tend to be more likely than children. Allergy tests is useful to an extent, but they can be positive when you aren't going to have a reaction and negative when you are. So they're not perfect and they don't predict it black and white whether or not you're going to react. Really, it comes down to a balance of probabilities based on all of those factors. The biggest predictor of whether you're going to react is your previous reaction or the reaction to a previous sting. If you have a severe reaction, you're likely to have another severe reaction. If you have a mild reaction, you're more likely to have a mild reaction. And there's some crossover between those based on all sorts of factors that can affect the severity of anaphylaxis. But there's no perfect test to say whether you're allergic to venom or not, apart from being stung.
So how could somebody tell whether they've got a serious allergy to a sting, and the difference between that and just an ordinary sting? You know, it'll hurt, it'll swell, it'll go red. What happens when somebody actually is seriously at risk?
So it can present in all sorts of different ways, much the same as other allergies can. Anything from pain at the site with maybe a tiny little spot of swelling through to what we call large local reactions, where the area of swelling is more than 10 centimetres wide is the sort of arbitrary cutoff for that. So if you're stung on the forearm and your forearm swells, but otherwise you're fine, we'd call that a large local reaction. There can be mild systemic symptoms like hives or itching or flushing without any airway, breathing, circulation type problems that would be seen in anaphylaxis. And then there's anaphylaxis, which has A, B, or C problems. So tightness in the throat, a hoarse voice, wheeze, cough, shortness of breath, dizziness, lightheadedness, potentially blackout. And they're all part of anaphylaxis. And obviously it can be more severe than that and potentially fatal. In terms of the difference in symptoms, venoms tend to have more of a blood pressure related reaction. So it tends to be a low blood pressure rather than wheeze and hives that you might get with food allergy, for example. So there is a slightly different presentation. They tend to be more low blood pressure with some hives, perhaps some abdominal pain as well is common in venom reactions. So it can be anything from mild through to those more severe types of reactions.
So there are a couple of treatments that are available for people with a serious allergy. What are the sort of things that people need to consider?
So firstly, it's important to, if you've had a reaction, a systemic reaction, or have a medical condition or a reason to be at higher risk, to feel that you're at higher risk, being seen in a specialist allergy service, or at least having advice from an allergy service, is important. Because venom immunotherapy, the treatments that you're mentioning, are very effective in reducing the risk of reactions, subsequent reactions. And it provides for Wasp allergy essentially complete protection in about 90 to 95% of cases, which is very beneficial. That's almost completely effective. B allergy, it's slightly less. It's about 80 to 85%, but that's still a fairly big protective factor. It is complicated in terms of the duration and the nature of the visits. It needs to be done in a specialist allergy centre. It's weekly doses for anywhere between 7 weeks and 26 weeks, depending on the protocol. They're the licensed protocols available at the moment. Some other products in other countries and very occasionally in the UK can have much shorter updosing periods of that. And then it extends out to every 6 to 8 to 10 weeks for 3 years at least, and occasionally longer. So it's quite a labour-intensive and time-intensive process, but there's a high benefit for it. The benefit really is improving quality of life, because you may be less anxious about being stung. It may be more comforting to know that in the context of heart disease or lung disease, you have at least reduced that risk that might occur in the context of venom allergy. And obviously the other treatments are the treatments of reactions. So adrenaline, EpiPens, or Jext or Emerade, whichever brand you have, is important. And there are anaphylaxis action plans all over the place. The Resus Council in the UK published guidance on management. And so anybody who's had a severe reaction should have adrenaline auto-injectors of whichever brand is prescribed. Knowing how to use them, and ideally having played with a practice pen, for example, to be comfortable in when and how to use them is very important, because early adrenaline for systemic reactions is the management. That's the main management. Antihistamines can be helpful for the itch and the rash, and particularly for local reactions, for example. Sometimes there's a bit of a delayed local reaction, which, if it's slightly itchy, may be a delayed immune response to the venom. If it's more painful, then it does raise the possibility of infection, which is often what is also thought about. Antihistamines can be partly helpful for that. And other medications like steroids are often prescribed. It's not essential. They may be helpful. They're often given by ED, but that's another treatment for venom reactions.
So I don't want to overwhelm accident and emergency or the ambulance services, but if somebody then does get a sting, never had one before, at what point do they think, actually, this is getting pretty serious? You've described the kind of swelling and the redness, but when do they kind of feel, the blood pressure, the fainting, the almost feeling as though they're passing out, I presume, or when do you then dial the 999? We advise not for people not to move, to lie down, to stay still. So going to actually seek out, if at all possible, to stay still, not to seek out assistance.
So airway, breathing, circulation is the sort of fundamental idea of when to call an ambulance. If you're especially anxious, that may also be a reason, particularly if there are underlying factors. But broadly speaking, airway, breathing, and circulation. So anything inside the teeth with tongue or throat swelling, vocal changes, shortness of breath, tight-chestedness, dizziness, lightheadedness. It's sometimes difficult to distinguish anxiety as well, because if you've been stung and you're worried about it, hyperventilating and your breath might be a little deeper, you may get some tingling around your lips. It's difficult, but it's better to call the ambulance. They'll come and assess you and say everything's fine, and off they go. It doesn't necessarily mean that you'll go to hospital, but it means you've got the safety net if you do need to. Then you've got help on the way. So anything inside the teeth really is a rule of thumb for that. Local reactions don't need an ambulance unless there are those other airway, breathing, circulation problems.
And going back to the treatment, presumably to access the specialist services at an allergy clinic, it's initially contact with your GP. Would the GP more than likely prescribe an adrenaline pen in the meantime? And you kindly gave us a bit of a plug. I should have said earlier on, there's tons of stuff on the Anaphylaxis UK website about adrenaline, about using auto-injectors. We've also got a great fact sheet and some information on immunotherapy, as well as running a bee and wasp venom campaign this summer. So come to the Anaphylaxis UK website. But that initial contact would be through the GP, get the adrenaline pens, and then a referral. But not every allergy clinic prescribes venom and immunotherapy. So it would have to be to one of the specialist centres.
Yeah, so the easiest way, your GP should know where the nearest allergy service is, and there'd at least be a direction from that. The BSACI website has a Find a Clinic page where you can filter by offering venom immunotherapy for adults or children, whichever is applicable. The emergency department should provide 2 adrenaline pens as you're discharged if you do need to go to the emergency department. But GPs likewise, and they would be able to refer you to an allergy service. Any anaphylaxis of any cause is one of the nice criteria for referral to an allergy service. So regardless of the cause, it's important to be seen in an allergy clinic, partly for the treatment, but also defining the cause and evaluating the risk and information and auto-injector training and support and direction to support organisations as well, which is knowledge is key, and knowing about it and what the risks are, how it might present, and how to manage it.
Totally agree. Yeah, I mean, Anaphylaxis UK, we want everyone to enjoy the summer, picnics, the beach, doing things that they and we all enjoy doing. Hopefully, when the sun comes out and we get a bit of summer. Andrew, that's been super informative, really interesting, and I don't think an area that people necessarily know so much about. We often talk about food allergies, peanut allergies, milk allergies, egg, or even maybe latex occasionally, but sting, bee sting, wasp stings, very serious.
Yeah, absolutely. It's about half of cases of anaphylaxis in adults are due to venom, and it's around about 20% of children. So it's not a small problem by any means, but it is often overlooked because of food allergy being a very visible, rightly so, cause of anaphylaxis. But we shouldn't forget the other causes of anaphylaxis.
We hope you enjoyed tuning in to today's podcast on this very important topic. To make sure you don't miss any episodes, you can subscribe to our podcast on your favourite podcast app, including Spotify and Apple Music. Finally, be sure to follow us on social media at Anaphylaxis UK to join in the conversation, and let us know if there are any questions you would like us to answer next time.